Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. This is my second lecture on facial nerve and I am going to discuss the first segment of the facial cranial nerve, and that is intracranial segment or the cisternal segment. So this is the vertical section of the brainstem of the hindbrain, in which the fourth ventricle is shown. This one is pons varoli. This is midbrain. This one is medulla oblongata. This is cerebellum. This is the fourth ventricle. Now there are some nuclei which have been shown here. This is facial motor nucleus. This one is the nucleus of abducens cranial nerve. This is superior salivatory nucleus. This is nucleus Tractus Solitarius. Now, first of all, we'll discuss what are these and where these are located. The first one is facial motor nucleus. Facial motor nucleus. This facial motor nucleus is basically located in the caudal part of ventrolateral pontine tegmentum. The motor fibers originate from the facial motor nerve. They run posteriorly, upwards, then take a turn around the nucleus of sixth cranial nerve, and then move inferiorly and emerge out of the brainstem through pons varoli. So this is the facial cranial nerve, main trunk, that is motor trunk. Now another one is superior salivatory nucleus. It also originates from pontine tegmentum. And it is basically a secretomotor nucleus which gives fibers, parasympathetic preganglionic fibers. It gives parasympathetic preganglionic fibers. Now these parasympathetic preganglionic fibers from the superior salivatory nucleus come out from the pons, and the sensory fibers for taste from the anterior two-thirds of the tongue. These basically and reach the nucleus Tractus Solitarius. So both of these combined and emerge out as a common nerve which is lateral to the main motor trunk of facial cranial nerve. This is known as nervus intermedius. This is nucleus Tractus Solitarius. It is a series of nuclei which is forming grey matter in the medulla oblongata. The rostral part of the nucleus Tractus Solitarius is concerned with the receiving taste fibers, and the caudal portion is concerned with the GI and CVS functions. So this is superior salivatory nucleus, secretomotor nucleus, and this is basically performing the sensory functions. So this is motor trunk, main motor trunk, and this is the nervus intermedius. Both of them move laterally and enter a bony canal in the petrous temporal bone, which is known as, it is bony region rather, it is known as internal auditory meatus. So This region, starting from the brainstem up to the start of internal auditory meatus, is known as the first segment, that is intracranial or cisternal segment. In the transverse view, we can see that this one is facial motor nucleus. This is facial motor nucleus. That is 7th. This one is 6th cranial nerve, nucleus of 6th cranial nerve, that is abducens. This one is superior salivatory nucleus. This one is nucleus Tractus solitarius, and this one is superior salivatory nucleus. Now the fibers from the 7th motor nucleus, that is facial motor nucleus, move like this. They will take a turn around the 6th cranial nerve nucleus and will emerge out like this. The superior salivary nucleus will give the fibers, and the nucleus Tractus solitarius will give the fibers. The sensory fibers from the anterior 2/3 of tongue will come towards the nucleus Tractus solitarius, and the preganglionic parasympathetic fibers from the superior salivary nucleus will enter the common nerve, and this is known as nervus intermedius, and this one is 7th motor trunk. Now at this side, this is the region from which the 6th cranial nerve emerges out. This one is 7th, and from here the vestibulocochlear nerve or the 8th, that is auditory cranial nerve, emerges. So this is the transverse section of the pons varoli. So this is the first part of facial cranial nerve, which is also known as intracranial or cisternal segment. It will end after entering the internal auditory meatus. The next lecture will discuss the second part of the facial cranial nerve. Hit the like button, share and subscribe our channel to get the latest updates and notifications.